All right, so now back to face-to-face presentation. My name is Carlos Gallo. Today I'll be talking about how to measure fidelity during implementation using computational methods. So today we've seen many different ways to measure fidelity that really required observation of the tapes and really highly trained individuals. And I'll be describing some of what are these measuring challenges that we have, how can computational linguistics help, and what are the advances that we have with computational linguistics that we can translate into our field. Present two proof of concepts, for one of them analyzing transcripts from Familias Unidas and the other one analyzing audio, and then what we can learn from this. So at the moment, we have great in artificial intelligence, great advances, and in particular with computational linguistics. So for instance, IBM has developed Watson, a computer program that can achieve human-level competency in playing games like Jeopardy. Skype now provides a real-time speech translation to its users, and Educational Testing Services provides scoring automatically of some students' essays. And they do this by essentially looking at some of the linguistic patterns that are linked to style of writing and high-quality writing. So we believe that some of this knowledge needs to be translated into our field so that we can enable this measuring fidelity that is about this type of communication. So what do we have right now? Essentially, we have a recorded session, some of the intervention. Only 10% usually gets passed on to a human rater that is the center of all the process, that is highly trained. It may take weeks to process, and then we arrive to some fidelity codings. What we see here is that this is an expensive process. We arrive to a micro session, so we listen to a whole tape and then we arrive to a global assessment of what happened in the tape. And what we proposed is using these advances in computational linguistics to then be able to scan 100% of the sessions and be able to provide reliable and valid machine-based ratings. And if you want to think about this, it's sort of like taking the pulse of the session, so kind of a heartbeat, and say, when is the peak, this is high fidelity, we have low fidelity, that we can do at each second of the intervention. And then at the end of the session, of the rating, we're going to have micro-codings that are at a fraction of the cost and related to what humans done before. So looking into the hood of what are these methods that we are proposing, I'll be presenting two test cases. One of them is extracting linguistic cues, and in particular the syntactic recognition. We're going to be looking at what are the syntactic patterns, linguistic patterns that are linked to fidelity. And then the second one would be based on non-linguistic cues. That will be about sampling and recognizing what is the emotion that the facilitator delivered the material, and be able to recognize that emotion. We also we can do gesture recognition, but I'll be just focusing on this part. And in the end, what I want you to think is about some kind of tablet application, phone application, where you will be able to display all these summary statistics of what happened in the session. So here we have this heartbeat that is going on in the session, and then we can then present a summary of there were 3 high fidelity sentences that were spoken, for instance, in any given time, and then there were 2 that were low fidelity sentences. And with that, we can then are able to highlight some period in the tape that can be flagged because there was a low fidelity, and then the tone that they presented with was also not corresponding to the protocol. And I just want to pause a second that this kind of feedback doesn't necessarily mean that it's a bad delivery necessarily. There will be these facilitators know their community a lot better, and they know what are the needs of the target audience. So what we want to do is, be able to track what are these adaptations that facilitators are doing, and so that then we can understand why it is that they're adapting, and then maybe learn from that. But we cannot do that. We cannot, positively learn about this if we're not tracking, in a more complete manner throughout the sessions. And then we can give some kind of feedback that is a global assessment of what's going on with the self, with the facilitator itself in previous sessions or in the current session, so that he can compare with himself or with the peers. These ideas have been reported in a number of publications from our group, in particular the Computational Future for Prevention of HIV, the Using Computational Linguistics for Fidelity Assessments, and Understanding Gesture in Miscommunication and Annotation. So all these references are at the end of the presentation. So the first proof of concept that will be presented will be based on the data that was collected in Miami with Willie Prado and Hilda Pantin, that some of these was already presented in another forum that was focused on the family back in April, I think. And Familias Unidas is a evidence-based parent training intervention that targets Hispanic youth. It is delivered in home visits by a school counselor. And essentially, this is done because of the implementation process. Now we're moving away from a research team that is highly trained, but rather somebody else that is doing this delivery of the material. This is probably one of the hardest contexts that we can be measuring fidelity because of a bilingual context. So we have an adolescent or young adult that will be speaking in English. We have a parent that's speaking in Spanish, and then a school counselor that is doing code switching between the two. And our goal then would be to recognize what is the type of questions or sentences or statements that the facilitator is making to the parents in order to engage them in that. And in particular, at least with Hispanics, there's an interesting paradox, because the children that are born in this country and are bilingual or presumably have more access to more resources, at the same time are less healthy than their parents. So these kind of interventions that are parent training are enabling the parents to transmit that knowledge that they have, so that then we can improve the health outcomes of the children. So, and with the more we can do to strengthen these units that are family-based, that will carry on with the life of the child, we're really going to get something that goes far beyond just the time of the intervention. We decided to focus on a part of fidelity that is called joining or engagement, and what Marianne described was also can be thought about therapeutic alliance. With fidelity, there are certain components. There's the content part, and then there's the process part. And we made a deliberate decision to focus on that process, on that quality of the delivery that we call joining, precisely because we want to be able to extend this methodology to many other interventions. If the facilitator doesn't get the tone right, then it would be harder to deliver any kind of material. And these essentially, in Familias Unidas, has been estimated that the cost to measure this fidelity is about $800 per day. So this becomes prohibitively expensive as local agencies want to pick up on these interventions and carry on the same work with the same carefully that these interventions were developed. So what are the kind of linguistic structures that we are interested in? In a process of knowledge engineering, talking with clinicians and looking at the transcripts, we identified a number of linguistic material that is evidence to joining and to fidelity. So, for instance, a facilitator may be giving statements like "you like school," or maybe asking questions. And there's the difference in the type of question that can be asking on a binary question or an open-ended question. So the more open the question is, the better of the joining we have. so that we can make this linking between what we are doing in the language and in the joining. So what we did is write a program that will be scanning for these linguistic patterns and then rating at each sentence. So we're going to have like these pulse thing throughout the session, where we're going to be identifying what is a good sentence that evidence joining, or one that is improvable. And what we have essentially is that we have a very good reliability between the machine rater, what we're automatically recognized, and those done by humans. The second proof of concept that will be presented will be based on the good behavior game. The good behavior game is a classroom intervention that targets to manage the behavior of first graders. And it has an impact on a wide range of outcomes for children. Here again, we decided to focus on the quality and the process part of the delivery. And part of that manual, part of that protocol is that the teacher that is delivering this intervention needs to be speaking in a neutral tone. So you can imagine how challenging this can be when you're giving instructions to 40 kids that are running around in the classroom, and you need to keep zen and speak neutrally. And what we see is that, that part of speaking neutrally is a key component of that competence that is only measured when there's another person coming into the classroom and then measuring what is going on. So we're getting guidance from Jean Podolska about what are the type of emotions that are necessary to recognize and what it means to be neutral during the speaking of the good behavior game. Right now we're in the phase 1, which is essentially a laboratory test. We're taking audio clips that were spoken by an angry person or a person that is speaking neutrally. And then we're doing some machine learning about what are the features in the frequency domain for these samples. So this is a clip that somebody that is speaking neutrally, and this is a clip that somebody is speaking with anger. And what we see is that there are a lot of features. This is essentially a spectrogram where we have the frequencies, high frequencies, low frequencies, and there's patterns that we can mine to actually recognize automatically whether that's one category or the other, neutral or angry. Here we have the results. We can recognize very well a clip that was spoken neutrally versus one that was spoken with anger. And when we then go beyond that angry and we include all other emotions, then we have an 87% accuracy, which is still pretty good. And just bear in mind, this is something that we can do at a split second throughout an hour of session, and then be providing more of a how did you start with these emotions, where did you move here, and maybe what happened. And one of these advantages of this is that when in traditional methods we have that we will going to give feedback to the facilitator weeks after the classroom took place. So imagine the supervisor say, remember that class that you taught 3 weeks ago? Well, this is what happened. And by that time, the person has already developed some habits of teaching. So you not only are talking about what happened 3 weeks ago, but then need to construct what's going on in between. So in summary, I'm showing you that technology can be used potentially to measure fidelity cheaply, accurately, and completely throughout the whole session and all of the sessions. And I presented 2 proof of concept based on Familias Unidas and the good behavior game, and how these approach can be generalizable to other interventions, precisely because we focused on that process aspect. So here's my information. Thank you. And I just want to do acknowledgments of all the people that I work with that have been really benefit for this to happen. Thank you.